friends, I am Dr Biren Nadkarni. I am consultant orthopedic, knee and hip surgeon. I am practicing at Holy Family Hospital and Sitaram Bhartiya Institute, New Delhi. Today we are going to discuss about knee osteoarthritis. So what is knee osteoarthritis? As the name suggests, it is basically the inflammation of the cartilage of the joint. It can happen in any joint, hip, knee, spine, hand. But today's video we are only going to talk about the knee osteoarthritis. So osteoarthritis is basically loss of cartilage strength or loss of cartilage space or basically degeneration of the cartilage or degeneration of the joint, which normally happens with growing age, and some other factors contribute to it in addition to growing age. So somebody who's had an injury in his playing days can get the same problem a little bit earlier than a regular aging. Females get it more as compared to males. This has been seen in multiple studies all over the world. There are some genetic constitutions also which leads to this kind of a problem. Other than that, there are other problems like gouty arthritis, psoriatic arthritis. They also lead to secondary osteoarthritis. And there are multiple factors, but osteoarthritis is basically the most common cause of knee pain in India and all over the world. And if we see a prevalence study, about 40 to 50% people above the age of 40 has this problem. So how does it present? It presents with knee pain initially, which is only on stairs, on walking up down the stairs. Thereafter, it aggravates to such a level where even basic activities of walking, going to the mall, going around, it aggravates the pain. Along with that, there could be a presence of morning stiffness. Once you get up in the morning, your knee feels tight and you take some time to get out, and with time it gets better. This morning stiffness, you might require you to take some medications in the morning, and ultimately your dependence on these medications increases, and thereafter your symptoms start worsening. So what causes knee osteoarthritis? Aging is the foremost feature which causes knee osteoarthritis. Although everybody who ages does not get knee osteoarthritis, but as mentioned earlier, the prevalence is almost as good as 40 to 50% in people above the age of 40 years. Females have it more as compared to males, and the same things which I mentioned earlier, they are the main risk factors of knee osteoarthritis. What are the symptoms of knee osteoarthritis? Main symptoms are always pain which is initially very gradual. It's only present on stair climbing, stair descent, or when you do extra work or something which is a repetitive activity which you have not been used to doing. So it generally starts like that. It was not there and you suddenly feel it once you do some kind of a work which the body is not used to do. Something like an extra stress you have added, like shifting a house or doing something which has just bothered the knee for some time. But thereafter, as the pain starts, it becomes more chronic, more indolent, and it requires more sustained attention. And that is the time most of our patients attend to visit our doctors. In addition to pain, stiffness is also a feature which we see later in the stage of the disease, where the person feels very tight in the knee, and there is something called a morning stiffness which present initially, but it gets better as you start growing up. And at this time, once the X-ray is done, and this is how it shows. So this is a normal knee joint which basically shows a thigh bone and the shin bone, and in between you can see the joint space. This is the joint space which we call the healthy joint space. We can see it is equal on the inside and the outside, and this is almost like a normal X-ray. This is the right knee, this is the left knee, and this joint space is basically occupied by the cartilage. In comparison, if you can see there is hardly any joint space left inside, and the bones are almost touching each other. So this is what we call osteoarthritis, and this is the left knee, the same thing showing on the left knee also. In addition to the reduction in joint space, you also see some kind of a deformity which has happened, which is basically like a bowing, which shows even on the normal patient if you see it from a distance, and it also shows on the X-ray. If you want to see in a model, this is what a normal joint looks like. You can see the healthy cartilage all around. This is a normal knee joint. And as we increase in the grading and the severity, the red spot basically mentions that there is a loss in the joint space, and this is the early osteoarthritic stage. As we progress further, this patches of loss of cartilage, they increase in size, and it can also happen on the kneecap, like showing here. And in the severest of all stages, there is severe loss of cartilage, and this is confluent cartilage loss. It is present on both the sides, the inside and the outside. And this is the stage where patient, if he has severe pain, stiffness, and loss of ability to move and do basic bodily functions, this is the stage we normally advise knee replacement. So friends, I understand through this video you have been able to gather enough information about knee osteoarthritis. Do tell us if you have any particular questions or queries, and do contact us personally.